Hey guys, Dr. Michael Hyman here. I just want to go through with you as to what to expect if you're going to be coming in here at my office, at least for a UroLift procedure. As you can see, I've done a lot of UroLift procedures. I've been designated a center of excellence, which just means I've done hundreds of these and have a lot of experience in treating patients with prostate conditions going back from the time I went to medical school, which is back in 1996 was when I graduated and started working in the field of urology. So I think I kind of came up with a rough number of around 65,000 men that I've treated for prostate enlargement conditions over the last 25 years. So I know a thing or two about it. Let me tell you about let me tell you about what to expect if you're going to be coming in here for a UroLift procedure. What we basically do is before you come, I always have everybody take just a mild sedative. I'll have you take like an ativan, a milligram of ativan. It's not like you have to do it, but it's just nice because a lot of the discomfort that might occur, and I will tell you, it's pretty unusual that anybody has significant pain during this procedure in my office. But a lot of the discomfort is from anxiety because you're tensing up. And when you tense up, you tighten your sphincter. Okay, think about it. If probably just me talking about it, you're tightening your sphincter. And when you do that during the procedure, it can be painful. So relaxation is super critical. I always give men a milligram of ativan to take about an hour before their appointment so that when they come in, they're fairly relaxed. They're not like falling over, but they're just, chilled. And then we have you get undressed, of course, and then the next step is to give you a local gel in the urethra, okay? The gel is chilled, okay, because it's much more comfortable going in when it's chilled. And you're getting basically 2 10cc syringefuls of this gel. So it's really gonna fill up the entire tube, if you will, with the numbing gel. It's basically a lidocaine-based gel and extremely effective, extremely effective. When you put the gel in, you want to leave it in for 15 minutes by the clock. So those of you who've had cystoscopy and maybe you're going to say to me, oh, the doctor gave me that gel and it still hurt when they looked inside my bladder, I would challenge you and say they didn't put in 2 full 10cc syringefuls, okay, so 20 cc's, and they didn't let it dwell for 15 minutes because typically you shouldn't have any discomfort after that. There are rare exceptions, and I'm happy to discuss that with anyone in terms of what we do in those rare situations, but 95% of the time, it's not a problem. You put that gel in for the full 15 minutes. At that point, we then have you position for the procedure. That means we do have to kind of put your legs up so I can get down there with my equipment. And frankly, we have a little drape going over the chest. It's just frankly, again, about anxiety. The less you see and the less you are involved with this, the better. So we have a drape set up and there's a lovely nurse that's basically right by your head. So she's basically monitoring you, looking at how you're reacting, making sure you're not in discomfort and pain, and talking to you and answering any questions or issues you may have. So that's really important. I think it's really key to have multiple people in the room so we're all kind of a team and we're all paying attention to different things. I'm really focused on your prostate, which is where you want me to be. The nurse is really focused on your level of consciousness, your comfort level, just any other issues you may have. And we have other personnel that are helping me with equipment. It's really important to have a team in place, and that's something we take pride in. At this point, after the 15-minute dwell time of the gel, we then begin you on a gas. Basically, it's a nitrous gas system called Pronox, Pronox, if you want to look that up. And basically, it's like laughing gas. It really helps calm you down. It's simply a little mouthpiece that you're going to inhale in and out. You control it. So if it's making you feel too lightheaded in some way, or you just don't like the way it's making you feel, you take that thing off your mouth, you breathe fresh air, and you feel normal within 10 seconds. It moves into your body and out of your body very quickly. At this point, we're ready to begin the procedure after 5 minutes of using the gas. You're numb, you're maximally relaxed, and I can then take my camera, pass the camera through the urethra, similar to when you probably had a cystoscopy, which you really should always have before a UroLift procedure, meaning not the same day, but days or weeks before. And once I'm inside the area of that prostate, like you can see in this picture right here, I then can deploy the implants and push the lobes of your prostate open. That portion, and usually I'll have to deploy 5 or 6 of these implants, sometimes 7. That portion of the procedure takes about 10 minutes, 10 minutes total. When we're done, I fill up the bladder with water until you tell me you feel like you have to urinate. I take out the camera, we put your legs back down, we take out the gas, let you breathe regular air again so you feel more alert, and then we walk you over to the bathroom and let you urinate. And as long as you urinate a reasonable amount of the fluid that I just put in, you get to go home. And that's basically it. You need to be driven here and driven out because you've been getting some of these drugs. But that's the whole procedure. That's what you can expect. Thanks.